My name's Caroline Homer and I'm the Co-Program Director of Maternal and Child Health at the Burnett Institute in Melbourne. I'm a midwife by background and I've been a midwife for about 25 years, and then a natural progression was into research. So how do we actually make the system better for all women, not just the woman sitting in front of me, not just the few that my students are going to involve with, but all women. So at the moment, the big issue I guess for mothers and babies in Australia is Aboriginal Torres Strait Islander women, and we really need to close the gap in Aboriginal maternal and child health. Just as an example, the maternal mortality rate is something like 5 times higher if you're Aboriginal or Torres Strait Islander. You're more likely to give birth early, you're more likely to give birth to a small baby. And we now have interventions that we know will make a difference to those women. And that research is also happening across the country to try and close the gap between non-Indigenous and Indigenous women. And the last area that's really important in maternity care is rural and remote services. And we really need to make sure that our rural services are as good as they can be, and that women don't have to travel to give birth. I don't know what you would think, but imagine travelling 800 kilometres from your hometown, leaving maybe your kids behind, and waiting to give birth in the next big town because you can't give birth in your own town. And we now know that we can provide services in those rural areas with good midwifery care, with good consultation and referral and good support. And again, that research has been funded by NH and MRC over the last 10 years, showing that these small standalone units, particularly in rural areas, are very safe and a really good option for women who live far from big towns.